Welcome, everyone, to the postoperative instructions provided by Dr. Bill Robertson and his team at billrobertsonmd.com. Following a successful procedure, it's crucial to ensure a smooth recovery process. Throughout this presentation, we will guide you through the essential postoperative care steps that we recommend to assure an excellent outcome. From medication management to wound care, we will cover it all. This video aims to address some common questions and empower you to take charge of your recovery journey and maximize the effectiveness of the treatment you've received. Dr. Robertson typically sees his patients back on the day after surgery, along with one of his physical therapists. There, he will review the operative findings and, along with the therapist, customize a rehab plan based upon those findings and the procedure performed. At that time, the therapist will remove the dressing and replace it with a smaller one. Please hold off on showering until post-op day number 2. You can sponge bath on post-op day number 1, but keep the surgical area and dressing dry. Moving on to day number 2 post-op, you can wave goodbye to the small dressing from the PT and those compression stockings that you may have left the surgical hospital wearing. But remember, don't get too hasty with those steri strips. They're here to stay for another 2 weeks. You can shower on post-op day number 2, but remember to cover the surgical site with plastic every time that you shower for 2 weeks. Once you've removed the dressing on post-op day number 2, you do not need another dressing. Just leave the steri strips in place and keep the incisions clean and dry. At the 2-week visit, Dr. Robertson's team will remove the steri strips and any non-absorbable sutures. When showering, it's important to avoid submerging your incisions until they have completely healed and are scarred over. This ensures that the incisions stay clean and dry, reducing the risk of infection and promoting proper healing. Remember to gently pat the area dry after showering rather than rubbing it to prevent any irritation or damage. By following these instructions, you can aid the healing process and promote a smooth recovery. Your diligence in caring for your incisions will contribute greatly to your overall well-being and comfort as you continue on your journey to full recovery. Dr. Robertson routinely applies a cold therapy pad to the surgical limb immediately after surgery, and the PACU nurses will then connect it to the ice machine when you roll into recovery. Patients rave about how these units help with pain. As you're managing your recovery, it's important to remember that there's no limit to the number of times you can use cold therapy throughout the day, but we recommend 30 minutes per session, with at least a 30-minute break so that it doesn't get too cold on your skin. If you don't have a cold therapy unit, don't worry. You can simply use regular ice on the affected area. A great tip is to place a thin rag on your skin under the therapy unit to provide extra protection. By taking these steps, you can ensure that your skin stays safe while receiving the therapeutic benefits of the cold therapy. Remember, consistent and safe application is key to reaping the full benefits of this treatment. The complexity of your surgery usually determines the length of your follow-up duration. This varies anywhere from 6 weeks of follow-up to 1 year. During the earlier follow-up appointments, you will typically also see a physical therapist in conjunction with Dr. Robertson. These visits serve as an opportunity for us to monitor your progress, assess any challenges you may be facing, and make necessary adjustments to your treatment plan. We encourage you to ask questions, share your concerns, inform us of your progress as we use these visits to determine the next progressions in your recovery. This collaborative approach ensures that we can tailor the treatment to your individual needs for the best possible outcomes.